There may be an easier and cheaper testing option for the coronavirus. Researchers from the Yale School of Public Health have developed a new test that could use your saliva instead of a nasal swab. It's called Saliva Direct, and the U.S. Food and Drug Administration has just been granted emergency authorization for this test. Here to tell us more about this exciting news is Dr. Chantal Vogels. So thank you for joining us, first of all, Doctor.
Thank you.
How does this all work? We are really excited to hear about this.
So our method is different in three ways. So first, as you mentioned, we use saliva as an input sample type. We skip the normal extraction step. So other tests usually use an extraction to take out the genetic material of the virus for testing. And our method is very flexible. So we validated reagents and instruments from different vendors to minimize supply chain issues.
And we, of course, will take the flexibility wherever we can, right?
Yes.
In your opinion, how accurate is it?
So one of the comparisons we did for the FDA is comparing the nasopharyngeal swabs with saliva, and we found 94% agreement between those sample types. So there's a high agreement indicating that saliva is indeed a good sample type for testing.
Wow, that's pretty accurate. Now, as you were mentioning, the NBA, they've been using it on some of their players, and they've been using it on their asymptomatic players, correct?
Yes, that is correct. And that is the next step in our development. So right now, the Saliva Direct method is approved for suspected COVID-19 cases. And the NBA study is to test asymptomatic individuals. So we're now in the process of testing that and trying to get that as an extension to the current authorization that we have.
All right, so that seems to be the perfect candidate, someone who's asymptomatic. Now, besides it being less invasive and a lot more accessible, what makes it less expensive?
So by skipping that extraction step, that's normally very expensive, and it also saves us time. So overall, if you just count for the cost for the reagents, we're down to about $1 to $4. And again, by having these reagents from multiple vendors, it kind of depends on which ones you pick for the total cost, but overall it's less than $4.
And before we go, if this continues to move in the right direction, where do you see this going? Could this be something we could get over the counter and maybe even do every day as part of our morning routine?
The test right now still needs to be performed in a CLIA certified lab, so a highly complex clinical lab. But we're further developing this and seeing if there's other ways of doing the test, for instance, with LAMP assays, which are tests that don't require these specialized instruments and machines. So we're constantly developing and partnering up with our collaborators to see how we can further improve this.
And we will keep that hope going. Thank you so much for all of your efforts and everything that you're doing there at the Yale School of Public Health. Dr. Chantal Vogels, thanks for your time.
Thank you.